What is suicide and how can it be prevented? Suicide is when someone harms themselves with the intent of ending their life. All people can be at risk of suicide, no matter their age, gender, or ethnicity. Although there is not one main cause of suicide, the main risk factors are depression, chronic pain, a history of past suicide attempts, a family history of mental health disorders, and substance abuse. Another major cause for increased suicide risk are stressful life events. This can include the loss of a loved one, bullying, abuse, discrimination, or financial troubles. These events may also occur at the same time as other risk factors to exacerbate someone's risk for suicide. Here are a few warning signs that you can identify in someone to recognize if they may be suicidal. Talking about wanting to die, talking about feeling hopeless or feeling trapped, withdrawing from family and friends, giving away important possessions, or taking great risks that could lead to death. Other serious warning signs are using alcohol and drugs often, having extreme mood swings, drastically changing eating or sleeping habits, making a plan or looking for ways to kill themselves, and talking about feeling guilt or shame. None of these are ordinary responses to stress, and if someone you know is exhibiting these signs, you should get help immediately. What is suicide prevention? Treatments have been developed for individuals who struggle with suicidal thoughts. These treatments include safety planning, follow-up phone calls, access to resources, psychotherapy such as CBT and DBT, medication, and collaborative care, some of which also serve as suicide prevention techniques. Safety planning enables a patient to work with a guardian to find ways to limit their access to any dangerous substances or weapons and create a safer living environment. It also helps a patient identify coping methods and various resources to help them in a crisis. In addition to safety planning, follow-up phone calls and further screening have also been proven to reduce a patient's risk of suicide. Various psychotherapies are used to help patients who have attempted suicide in the past. They may also aid in the prevention of a future attempt. There are two major therapies known to help suicidal patients: cognitive behavioral therapy, also known as CBT, and dialectical behavioral therapy, DBT. The National Institute of Mental Health has a service called Find Help for Mental Illness on their website, which allows patients to find mental health professionals in their locality. In some cases, those who deal with suicidal thoughts are prescribed medication to reduce their risk of an attempt. Patients can work with their professional health provider to see what would work best for them. Lastly, collaborative care is when a behavioral healthcare manager works with a patient along with their main healthcare provider and other mental health professionals to create a specialized treatment plan for the patient to reduce their suicidal thoughts. Family and friends are usually the first ones to recognize the warning signs of suicide and can start helping a loved one find treatment for mental health. There are steps you can take to help a loved one who is in emotional pain. Terms such as committing suicide, successful suicide, and failed suicide carry negative connotations and should be avoided. The first step would be to ask a struggling loved one if they are thinking of killing themselves. Studies show that asking if they are suicidal does not increase suicidal thoughts. The second step would be to keep them away from harm. Remove any access they have to lethal items or places. The third step is to be there for them. Listen and empathize with what they are feeling and thinking. Studies show that talking about suicide can actually decrease suicidal thoughts rather than increase them. The fourth step is to encourage them to use resources that can help, like the 988 Suicide and Crisis Lifeline number and the Crisis Text Line number 741-741. Young people may find it easier to use text lines instead of having to call a number, and it's also sometimes comforting to know that crisis counselors are most often experienced and well prepared to listen to anything that people are struggling with. The last step would be to stay in touch with loved ones, check in on them and how they're doing, and let them know that you are there for them.